Hi everyone, very good evening guys. I hope I'm audible and visible to all of you, and this is a very short session which I thought is mandatory at this point of time, considering so much of confusion and chaos that has been created due to repeated notifications and interviews that are happening. So I thought it's a must that we should connect, because I cannot even imagine the amount of chaos that must be going on in your head at this point of time. So yes, first and foremost, this is only a session where I'll be helping you with two things. First, I want to have little bit of peace amidst the chaos, because the amount of pressure and the kind of feelings that you must be having at this point of time, being so clueless, not knowing that tomorrow morning when I wake up, what exactly do I have to study? What is the pattern that I have to study on? You feel so clueless and aimless in life. So firstly, to give you a little bit of calmness, to give you a little bit of peace amidst all this chaos that is happening. And secondly, as a PrepLadder faculty, I really want to tell you how or best we could do overnight to help you with all the things that are going on, right? So for those students who are, if you don't know this, you are probably living in some other world if you are not aware of the fact that recently by the health minister in one of the colleges, there was a statement which was said that there will not be NExT for 2019 batch and NExT will begin for 2020 batch. So this has very clearly been said in that interview, although an official notice from NMC is awaited, but NExT will not be applicable to students of the 2019 batch, which mainly means that someone was asking me, December FMG hoga? Of course hoga. So in fact, NEET PG 2024 will also happen, and as per that statement, FMG exam will also happen in the following year, of course. So this is settled. There is no confusion. And as I said, you need to be living in some totally different world if you don't know that this has happened since yesterday. I'm sure everyone is aware of it. So this one question, right, that has come is कि December FMG होगा, of course होगा. NEET PG 2024 will also happen. In fact, 2024 FMG will also happen. So mainly means that NExT that they are talking about will now come up in 2025. That is as per that one statement, which we can only rely on because we don't have any other notice at this point of time. Abhi we've got into that mode of daily. Every day we will be given, one kind of shock in our life, and we'll now become so resistant and made of steel that any shock that comes our way, we will absorb it so well. So I know after that one statement yesterday, there was a meme fest that started off on social media, because everyone has gone into that mode that, sometimes you are given so many shocks in life that you just start laughing. You don't understand what is happening with all of you, right? And I think that is the mode that all of us have gone into. But all jokes apart, we need to come back and realize that, notices and notifications will come at any point of time. I need to be prepared in my strategy that, even if tomorrow the exam is there and tonight the strategy changes, my preparation should be such that I can attempt any exam on this planet. And how are you going to do that? Yes, I can see a lot of reactions coming that, okay, ma'am, I'm numb, I am at this point of time, I don't know what to do. So two things. Firstly, wait. What else can I say? Wait for the official notice to come, guys. This is one thing, because now although I would not say that official notice would be the end, because we've seen many notices change, but do not rely only on something that has been spoken about in one of the colleges. I would still, for a better guided approach, I would say wait for the official notice to come. That is one thing. Second, a very valid question Dr. Tulsi is asking, ma'am, karna kya hai? What does the 2019 batch have to do? What exactly does everyone have to do? So till now, I think, how many of you believe that whatever little information that I had in the brain, that has also been dropped off? Whatever little I had tried and motivated myself till now in this entire journey, now I feel everything is helpless, clueless, and I have just dropped it. Drain the brain. This is known as brain drain. Everything has been totally dropped out of my brain. I'm just telling you to change one alphabet, and what PrepLadder and we are going to help you is, we are going to help you train the brain. So first and foremost, how are we going to train our brain that no matter whichever exam comes up on this planet, I have to be able to solve the question. So this is exactly what I wanted to meet you guys for. Is anything going to change in your full course videos at this point of time? No. Is anything going to change on the most golden aspect of your preparation, that is rapid revision? Ye bhi change nahi hoga. This remains the same. And it's very easy to say that, but somehow you guys are not ready to accept it. But trust me, ye dono cheezein same rahengi. The course is not changing, 19 subjects are not changing. 2024 batch ya fir university batch ya fir even for people who are now knowing that in 2025 I'm going to give NExT, for each and every person in the medical curriculum, this is not changing. What is changing now is definitely this. So many of you are believing that मुझे अपने content को change करना है. I have to change my notes. I have to change my source. No guys, this is not to be changed. This goes as it is. If you were listening to medicine videos, continue. If you were listening to gynae videos, continue. Even if you were listening to first, second year videos, continue, because that is not changing. You just need to change this aspect. And again, how is this going to change? So now one thing that I want to tell you, why did I say train the brain? Because we have come up with a new feature, that is flip the question. Although it sounds a lot like, do you all remember we used to have this, or we still do in KBC, we have flip the question. When you don't know a question, you flip the question. So yeah, something like that we've got, except for the fact that you can't flip the question and change it. Even if you don't like the question, you will have to stick to the question, but that will help you. And trust me, just listen to me for 1 minute, because after this you'll realize that no matter whichever exam pattern comes, if I practice in this manner, this is how I will be ready for any challenge that comes my way. So remember, this is the, I think I have not seen this feature earlier in my life in any other, in be it medical or non-medical profession. So I have called it flip the question, which basically means that now guys, whenever you open the Q bank, and this is a live screenshot which I've got you from the Q bank, whenever you open the Q bank, if you look at the extreme top, you will see these two options, and that is what I call as flip the question, which means that first, when you look at clinical, you will realize that here I've got you a long clinical history. I'm not here to teach you, but quickly agar jaldi se 30 seconds mein padhe. So we had a young adolescent girl who's come to us with breathlessness, chest pain, and there is also going to be difficulty in breathing, as said, with a pansystolic heart murmur. So till here it is a cardiac condition. And then when I come to the chest x-ray, there is significant enlargement of the heart. When I talk about the autopsy, because they are saying that despite all these efforts, the child or the adolescent could not be saved. So at autopsy, I can see mononuclear cells arranged around eosinophilic collagen. Guys, eosinophilic collagen and uske aspas mononuclear cell. This is the classical description of Aschoff bodies. Now tell me, did medicine change? No. Did the pansystolic murmur change? No. Did pathology change? No. And what is your answer in this case? It is very, very certain that my answer is rheumatic heart disease. But now if you want to practice this type of question, you have an option that you click on the clinical aspect. You don't want to practice this and you feel that I am preparing for December FMG where I might get shorter questions, or I am preparing for 2024 NEET where maybe these length of questions will not come. So what will you now go and do? Now you will go and click on the other aspect. You will go and click on the one-liner one. Same question, look at this. Same question, same options, but how the question has become shorter. That is, what is the most likely diagnosis in a 16-year-old if you're seeing the presence of Aschoff bodies? It has become a fact question, ratta question. Your answer still remains the same, that is rheumatic heart disease. And that is exactly what NMC is also doing. Na flip kar rahe hain every day. One day some notification comes, next day some other notification comes. So the answer to one flip is another flip in your life, which basically means that when you don't know what to study, that is not exactly what you have to know. Padhna kya hai, that remains the same. Practice kya karna hai? What do you have to train your brain to do? You have to train your brain that if this length of question comes, then also I should be able to apply my knowledge. And if this sort of question comes, then also I should be able to apply my knowledge. So that is what exactly has been introduced in the app, and that is already a part of the Q bank. So as of now, of whatever I have seen that is going around, this feature has not been introduced, or you guys have not practiced something like this earlier. But trust me, if you start practicing this way now onwards, NMC can give you any pattern or any notice tomorrow. But if you have been practicing in this manner by attempting the same question in a clinical format and then attempting the same question in a one-liner format, no notice can scare you after that. So my take home message for all of you still remains the same. Are you gonna change your, because I've seen a lot of students, if you're not happy, you're feeling कि जो भी नहीं कर रहे थे अब वो करना है. So if you guys were listening to video lectures, you have jumped to live lectures. If you guys were listening to live lectures, you have jumped to recorded lectures. So basically you are feeling that जो कर रहे थे, now I have to do the opposite of it. No guys, whatever you were doing still remains the same. If you were following rapid revision for NEET 2024, it still remains the same. The only thing that I want you to change is this over here, and that is the Q bank. Practice change karna hai. Strategy does not have to change, and I don't know why, but every student who's written to me has told me that, ma'am, should I, because earlier I was doing this means now I have to do the opposite thing. No, whatever you were doing remains the same. That is the take home message, and you will actually start seeing a lot more questions. I'll show you one more. For example, this is a surgery question where first again, when you clicked on the clinical aspect, you could see this was a classical case of, kaun sa case hai? You have a patient, a 62-year-old patient with abdominal pain, there is bleeding that is happening, there is moderate edema, and then you see colonoscopic findings are showing you narrowing, there is severe stenosis and obstruction. And once I write the word, अब देखो integrated, कहाँ से कहाँ start हुआ? It started off as a medicine question, it has gone on to colonoscopy, it has gone on to radiology question. The barium swallow study shows apple core appearance. Apple core appearance of the intestine means we are dealing with a case of colon cancer. And what have they gone down to? They have gone down to asking you what is the most important prognostic factor for the disease. Now this is one way of asking you a question of colon cancer. I'm not here to teach you, I'm just here to tell you कि करना क्या है. So we are not discussing the prognostic factors, but you know that okay, this was colon cancer and then they've asked me prognostic. Now this is when you clicked on clinical. इसी का one liner flip. Should we flip the question? Are you feeling a little bit like KBC at this point of time? Okay, so it becomes a little gamified version also. You flip the question and what do you get? Now you get the same question in a shorter format, in a ratta format, which is the most important prognostic factor for colorectal carcinoma. So as I'm trying to tell you again and again, now when you, all of you, whether you are on, you will find this clinical versus one-liner, and this is exactly what you guys have to now change in your preparation. So you follow the same lectures, you follow the same RR, and this is the only clinical versus one-liner flip that is currently available for you to practice, and that is all that is needed. If you've joined this session, I'm sure you have at least 1% faith you have in me, and that is why you've joined this session today. And if I can take the guarantee on me and tell you that is this actually the only change you require in your curriculum at this point of time, yes. And whether you're appearing for FMG में clinical question आता है, 50% clinical, 50% one-liner, same for NEET and same for NEXT. Nothing on that aspect is changing. Of course, after this, right, so yeah, what is the next thing that you guys want to ask? It's open for discussion, but yeah, this I just wanted to tell you because a lot of people ask me कि मैम अब question bank सिर्फ NEET PG या सिर्फ next वालों के लिए होगा, will it not be for us? No, you have questions which are going to be subject wise. Please note that whatever questions you were having subject wise for NEET PG, they are still there, and whatever questions you needed on clinical grounds for next, they are also added, and उसमें flip का भी option है. Nothing is going anywhere, neither do you have to go anywhere. You follow the same pattern, right? And for students who are talking about FMG, again and again, same question, December FMG क्यों नहीं होगा? When next is only not being planned for 2024, of course your December 23 exam has to happen. It's not going anywhere. In fact, the next year 2024 FMG will also have to be conducted because next is not being conducted. As I said, you need to be living somewhere on Mars or some other place to have missed this notification yesterday. Although I wouldn't call it a notification, I'll call it just one verbal statement. But yes, the verbal statement has come from such an authority that definitely it has to have basis and it has to have grounds. We are still awaiting a notification, but at least one relief for one batch has come, and I'm sure 2020 batch people must be thinking that why are we not in 2019? Right. Next, yeah, 2020 batch students have come. They have that sad emoticon, which is obvious for you to have, because of course you will feel jab ek aur saal delay hua tha, to why not one more? And I would have also passed out of it. But let's, assume that at least it's not come to you overnight. It's not been told to you right now that after 3 months you have something like NExT. That is, you've been, well, in 2023 at least you are being told that in 25 this is something that is gonna come on your head. So be mentally prepared, and I've already told you what to do. Okay, many of you have also asked me that what is the basis and what is the thing for first and second year subjects, because everyone is now believing third and fourth year ke subjects padho ya final prof tak you are gonna study, and after that it really doesn't make a difference. Whereas when you're talking about first and second year subjects, you can just chill through it. Well, let me tell you that the questions that I showed you, for example, were particularly put up over here because I wanted to tell you that although this might sound like a medicine question, but at the end of the day, a pansystolic murmur in a 16-year-old girl can be seen in many, many causes. Till the time you do not know how an Aschoff body looks like, coming to your final answer becomes difficult. Same for colon cancer. For colon cancer, you might feel that, okay, colonoscopy likha hai, but colonoscopy can show you so many features. It's just shown you stenosis, which can be seen in so many different growths and polyps also. Till the time you did not read the radiology barium study of apple core, that's how it's in. कहाँ का question बताओगे? Medicine, surgery या radiology? सबका question है, right? So that is what I'm saying. If you feel that you're gonna ignore one aspect of the subject or curriculum and only directly jump to third and fourth year, that's not going to happen, guys. Your question will be framed in a manner. Have you guys solved UWorld या USMLE questions which are even lengthier than this? Can you ever segregate कि ये anat का question है, path का है, micro का है? No. It looks as if you're approaching a patient, as if you're talking to a patient. A patient is giving you his or her clinical history, and then after that you cannot tell a patient you belong to the chapter of anatomy or you belong to the topic of microbiology. Then that's a patient in front of you, and that you can give a diagnosis if you have a wholesome knowledge of everything that has been given over here. So don't feel that I will not study anatomy. One little change that I can, or I can expect you to do is that for these two prof subjects, for students targeting NExT, start focusing more on applied aspects. And do I need to do anything extra for that? No. As you will solve the questions, that onus we have taken on ourselves, that as you will solve the questions, uska jo applied aspect hai, what is the applied version, what do I have to focus on, that we've taken care of. So that will be taken care of in your Q bank. So my only take home message to you, all of you, is that everyone is running after which new notes to study for this particular exam and this changing paradigm shift that is happening, whereas you don't have to study any new notes. You have to do a new Q bank for this. You have to practice something different for it, and that is exactly what has been settled within this week. All of it has been prepared and it is live on the app for you to practice from, right? Okay, so any other questions that I'll take up quickly? Right. Regarding the mock test, regarding the money that was told for the mock test, we will have to wait for notifications, guys. These are things that we can only assume, and assumption mein time waste karna is the easiest time pass that someone can do. That you sit in a group of 10 people and everyone gives their own mind frame, mind thought and thought process, but these are assumptions which are just wasting your time. So at this point of time, what you can do is, whatever subject you were studying, just forget that this happened. The notice came and then it was cancelled or whatever happened. Bhul jao. Till the time the next notice does not come, just continue to study whatever you were studying. Start solving the new Q bank. These are the things that you can do at the ground level. At least be faithful to yourself and your conscience that, tomorrow you should not be able to say that I wasted time in all of these notices that were coming. That guilt is the worst to have. I don't want you to have that guilt. That is why I'm coming again and again and telling you that apna padhte raho, so that later on you'll say, okay, yeah, I wasted 1 or 2 days, but nothing beyond that. Don't let that one day become 1 month, that I didn't study anything for 1 month because I was constantly following NMC notices all that while, because that is not going to help you, be it any format that will come. Okay, MI reinfarction. Someone still wants to study amidst the chaos. The reinfarction marker is now troponin in I, so I hope your answer is settled. Okay. Okay, so I think everyone seems to be a little settled now? I hope so, yes. And regarding daily targets, Dr. AK, I've read your message. We will work on it and I'll let you know whenever that is planned. Regarding clinical case discussions, Dr. Vikas, again, those are something which are in the pipeline, and because now a new pattern is being done, so it also has to be, things have to be put up in accordance. So whatever new videos will come on the app, we will make sure that they are in a manner that go well in alignment with the pattern that is coming up. So we will keep you informed about that. Dr. Dheeraj, I've already answered. FMG December 2023 is certainly going to happen, just in similarity to how it has been happening till now. So in case you've not been studying, please start ASAP, because pakka hone wala hai, right? Okay. Fine. So I guess regarding FMG students, I have answered it. Abhi July session to ho hi raha hai. We all know December is also going to happen. In fact, 2024 is also going to happen. ठीक है. So Dr. Shobhi, no, there are no new videos. Whatever has been uploaded is already done. Okay, so I think we are settled on all of this, and most of the questions that I see are coming out as repeated, with one last question for students appearing for 2024. As I said, nothing changes in your preparation. If you were looking at the full course videos, continue. If you have come down to RR, and every time you'll say ma'am comes online and keeps talking about her RR above path and micro, because this is something I am personally very proud of, that RR is something that 2024 people have to do, not just for path and micro but all 19 subjects. But for path and micro, I have to tell you that you have to do this, because the amount of content that has been concised in this limited time frame of 15 hours of path and micro is immense, and trust me, it is going to give you the best possible result when you sit down to solve the question bank. So for 2024 aspirants, nothing changed except that you wasted 1.5 weeks of your life. Other than that, nothing has changed. You continue exactly how you were continuing up till now. Okay, so yes, we've got some old students also joining in. Dr. Nanavel, of course, I remember you, and please do join in and tell the students that how you also have gone through similar emotions in the past, but eventually everything turns out in everyone's favor and everyone will sail through. It's just about keeping a little calm, a little composed, and also having faith that whatever you are studying is the gold standard. That is one faith we don't have. We always feel what my friend is studying on a different application, that is the gold standard. But yahan par 50% of the battle is lost because you feel grass is greener on the other side. You just have to have faith in yourself that whatever I am studying, if I have been doing my RR and full course and QBank, wahi best hai, wahi gold standard hai, that is what will get me the marks. I don't have to get wavered, I don't have to get distracted. Okay. Yes, Dr. Vikas, we've also got another thing that was put up by the health minister, which also said that this will be more or less like a licensing exam, and you know there will be 2 exams that will be there. But if you read, I also went through that entire video clip that was circulating, and this created all the more confusion. So my advice as of now is that only focus on the aspect that is clear, and that is what clearly he mentioned in clear words was 2019 batch not having NExT in 2024. So you guys are going in for NEET, and beyond that, whether it will be a license exam, qualifying exam, 2 exams, university plus NExT, let that come in a phased manner. Let that be put up as guidelines in black and white. Let them give us a mock test. Let them tell us that which batch will be approached in what manner. Then we'll have a discussion on that. Abhi ke liye, what you should be doing, that much I have told you, and I think that is all that is required. Okay, FMG December, of course, if NExT is supposed to happen in 2025, then 2024 mein to obviously FMG exam will happen. Na? Otherwise, where will the FMG students go for one entire year? They can't have no exams. It's just simple, plain common sense that if this 2025 is the plan for NExT, then 24 will have FMG, of course. Right, and the crying for 2020 batch continues, so that I would not take up. But thank you so much guys for joining in, and yeah, so as I said, this session is to tell you about, now you can check out the QBank. You can, you know, after this you can practice the QBank. You can see flip the question. It's a gamified plus learning version, I feel. And on the same pattern, I will be meeting you on Monday and Tuesday, because there are 2 sessions planned for pathology at 12 noon, mid-noon sessions, so that you guys don't sleep off. And yeah, Monday and Tuesday I'll be meeting you, 2 days of path, where I will make you solve every type of question to calm your nerves a little bit more. every type of question from every chapter, I will try that, okay, if it's a lengthy question, how will you approach? If it's a short factual question, how will you approach? So yeah, that will further, I hope, help you calm your nerves a little more, right? So the only thing that you can do right now is, if you want to gain that confidence, you can probably just go and start solving a few questions on the app, try the flip version, and see that you will actually gain that confidence that nothing else had to change except for this. Okay, fine. So I guess revision sessions on YouTube, yeah, of course, NEET PG 24 is way ahead. We will have YouTube sessions, there's no doubt about it. Live classes have always happened for every exams. We had live classes for FMG students last month. We will have live classes for NEET PG also on YouTube. Nothing is changing. NMC can change notices. We are not changing anything. I'm not changing any stand on any class. Everything goes as it is. Don't worry about it. Okay. So, yeah, Dr. Vivek, if you're saying that for some questions, every question cannot be framed into clinical and non-clinical. अब हर question में वो possibility ही नहीं है. That is why I will also say that, you know, some questions are meant to be mugged up. I mean, if they're wanting to ask you the chromosome of P53, what clinical aspect can I put into it? Nothing. That is, some things are so much into ratification, so much into cramming up, then let that be as it is. Wherever you feel that, yeah, a clinical acumen or a clinical aspect can be added, that has been added, and then you can flip the question and attempt it. But some questions will remain as it is. Scientist का नाम है, scientist का contribution है, what clinical aspect should we add to it? Nothing. That is just creating bulk unnecessarily to show you that, oh, we've got you a clinical question for everything. We don't want to show off to that extent. We want it to be very realistic. What is factual will remain factual. Wherever clinical aspect can be added, has been added. Okay? Right, so yes, thank you so much for joining in, guys, and any other queries, as always, please put it up in the comments below and I will get back to you. I'll reply to you to the best of my ability, so just drop in a comment under this thread. Thank you so much, all the very best, God bless, and I know you guys need a lot of power and strength because this is a very, very testing time for all of you, but be rest assured that we are all with you and we are making minor changes on a daily basis, so as new notices keep coming up, we will be standing beside you at every step. So at least have that much of surety from our end, right? Thank you so much. All the best. Keep studying, most importantly, and God bless you all.